Hi, and welcome to episode 121 of the Untethered podcast. Today we have Dr. Ryan Robinson joining us. Dr. Robinson graduated from dental school, and he couldn't wait to get back to the community in which he grew up. He was looking forward to helping people achieve their perfect smile. Little did he know that a few years later, his background in dentistry would give him the opportunity to look beyond the teeth to something that could have changed his patient's overall health: the airway. Dr. Robinson is Delaware's first and only doctor triple board certified in craniofacial pain and dental sleep medicine. After many years of treating the airway in his general dental practice, Dr. Robinson decided to open up a specialty practice to address the needs of the community. This practice, called the Pain and Sleep Therapy Center, focuses on finding the origin of the problem as opposed to treating with medications and Band-Aid fixes that have become so routine in today's medical system. Dr. Robinson dedicates his time to treating craniofacial pain, including TMD and headaches, sleep breathing disorders, including snoring and sleep apnea, as well as dentofacial orthodontics, which focuses on proper development of the face and airway. Dr. Robinson treats patients of all ages and states it's extremely rewarding to help an adult enhance their quality of life by finding and treating the source of their issues. What's even more powerful is treating children and having the opportunity to cure their problems. He goes on to say children are the most fun because with early intervention and therapy, we can help the child grow and develop properly, saving them a lifetime of issues that otherwise would not have been identified. We focus on identifying these issues at a young age so we don't ever have to treat them as an adult. Dr. Robinson is a published author and is passionate about spreading the message of airway health through his book, The Root Cause: Discover the Why Behind Your TMJ and Sleep Issues. In his spare time, he enjoys spending time with his wife, Renee, and their two children, Bryce and Reese. He also enjoys golfing, attending sporting events, and traveling. Quick disclaimer: all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider. Welcome to the Untethered podcast. I am your host, Hallie Balkan. I'm a certified orofacial myologist, feeding specialist, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, tethered oral tissue, and airway space. I challenge you to keep an open mind and join my mission to get this information out to the masses. Let's get started. Ryan, thank you so much for joining me today. I'm excited to talk about all things, TMD and airway and all the amazing things that you're doing out there.
Yeah, thanks for having me. Let me just first start by thanking you because I feel like in this field that we're in, the airway space, even TMD, the TOTS world, and myofunctional therapy, like there really isn't, that many great resources for information for people to come and kind of learn about this stuff and become more aware. So I applaud you for what you're doing. It's incredible. I wish I had the time and energy that you have to kind of get this message out to the world. But I've been following you since you started, and I think you have the world's greatest podcast. I listen to it all the time, and I just want to thank you for your contribution to the field, because without this, I don't think half of us dentists are even looking at the things that we should be looking at. So thank you for everything that you've done for us.
Well, thank you. It's been really fun and really amazing. I'm not sure how I found the time for it either, but I think it came to the point where I said, I just went to look for the podcast and it wasn't there. And I was like, oh man, this is totally my MO. I'm like, all right, well, we're just going to create it then. Let's do this thing. And it's really been amazing because I've gotten to meet so many professionals and individuals in the space that I never would have crossed paths with, I think, otherwise. And so it's really been a great connecting up, great networking and connections have been, and it's so fun. And I love connecting families, especially with professionals and other professionals with professionals. So it's really given me that opportunity to do that and really help families get the care that they need to. So even if it's not my team, and me who are working with them directly. But anyway, so let's talk about you. So let's jump into your journey and, your journey into the TMD space and the airway world. How did that happen for you?
Well, I've learned through doing a couple of these podcasts that we don't really have time for it all. So I'll try and kind of hit the key points here. But, like most, I'd say, hungry, ambitious, young dental professionals in the world, I graduated from dental school in 2011. I was indoctrinated with this information that I thought was Bible that I thought was the word of the Lord. And I came out just extremely hungry, ready to learn, ready to, give people smiles, ready to, change people's life through helping out with their teeth and their oral health. And I came into the dental world really quickly. I bought a large dental practice in my area where I grew up in, which is Delaware, which is actually a state. If you didn't know that, it's the first state. People just know it as like the 20 minutes that they pass on 95 to get to DC and Philadelphia, but it actually is a state, and you can stop and say hello. We have some good beaches down here as well. But anyway, so I came back to the town that I grew up in and bought a pretty big practice. There was a couple dentists there. I came in, I purchased it. It was a guy who was kind of considered one of the godfathers of our communities when it comes to dentistry. I learned a lot from him from the business aspect of things. But I kind of came in with my own ideas. I kind of came in with my own business acumen, my own business plan. I created what we now refer to as the wow experience, where I just wanted to, like, literally every single patient that walked in the door, I wanted them to have a wow type of experience. So they went and told their friends and family, and we grew pretty fast and we grew pretty significantly. And, life was great. My wife and I had been married for, I think, 4 or 5, 6 years at this point. A couple of years into dentistry, we got married in dental school. Actually, we're middle school sweethearts, which is just wild. So we got married early in dental school, and we were living a great life. I was making a ton of money. I was helping change people's lives. I was the CE junkie. I was just traveling around the country on the weekends, like learning everything I could. I wanted to be the best root canal specialist. I wanted to be the best implant dentist. I was doing orthodontics. I was doing surgery, third molars and stuff like that. There wasn't anything that I didn't touch, just because I was extremely excited to be able to do all these things. So that was all going all well and dandy. And, I chose dentistry because of that, cushy lifestyle and the ability to not deal with morbidity, mortality, the ability to have weekends and nights free and, create this life that I wanted. That's the whole reason I became a dentist. No offense to dentistry, but I didn't really know if I would love it until I got into it. And then, so the world kind of changed. And probably, as when you have kids, I felt like I was just going a million miles an hour down the freeway, grabbing everything in sight that I possibly could, and, trying to do as much as I could. And then I had my first, child, and in 2015, and it was like the perfect storm of intervention in my life that I needed. And it was just like, whoa, now life had a little bit more of a meaning to it. I took my first airway course in 2015. This was 4 years after I graduated dental school. I didn't even know what an airway was. I think the title was a big conference, and the title was like, add an additional $1 million to your practice. And I'm like, yeah, that sounds great.
Cool.
I'd like to add an additional $1 million to my practice. So I did this breakout session, and I'm like, holy mackerel, everything that this guy was saying, I was like, wow, I've been looking at this stuff forever, and I've just been ignoring it. And I've just been, thinking that it was a variation of normal. It's what we were taught in dental school, is hey, this stuff is just a variation of normal. This stuff is, just something that's there, and we don't know why. And so that kind of made me raise more awareness to well, why, and we're going to talk about my book, I know, but that's the whole thing. Why? And so I've really never been the guy to kind of stay within the rule book and sort of, just do what I was told. I was always the person who kind of challenged the norms and asked why, and said, well, why not? And, how can I possibly do better than what's currently going on? I believe truly that if we bring an open mind to every situation that we come into, we're going to learn. And when we learn, we're going to do better. And, I have quotes all over my office, all over the walls. And one of my favorites is that Maya Angelou quote that says, do the best you can until you know better. And then when you know better, you do better. Right. So that's what kind of we do. So 2015 changed my life. My son was born. I took my first airway course. I came back with a full head of steam. My staff thought I was absolutely crazy. I had 5 hygienists at that time. We were cranking. I had 3 doctors working for me. I mean, we were a big, huge operating practice, making a lot of money, treating a lot of patients. And I was like, pause, time out. We need to start screening for the airway. And people were like, what the hell is that? And I'm like, well, here's what this is. And here's what we need to do from now on. So we just started screening and referring out for sleep studies and things like that. And organically, this just continued to grow. And as I saw more people come back that were treated with CPAP successfully, I'm like, wow, we're really, well, like I had, wives that were, coming in and saying, you saved my husband's life. Or the reverse, right? I got back in bed with my husband. I was the one who was snoring, right? And so it was just this wild sort of paradigm shift in my life that just made me get even hungrier and made me even be more devoted. And so, fast forward a couple of years to 2018, and literally from 2015 to 2018, I went on this intense, while we had our first, son, and then in 2017 we had our daughter, Reese. And so throughout that time, I was just burning and churning on CE. I put everything else aside. I didn't want to do another root canal. I didn't want to place another implant. I just wanted to learn about the airway. And in doing so, I learned about, craniofacial pain and that type of thing. And so 2018 comes, and I'm literally sitting for 3 board exams: American Board of Craniofacial Pain, American Board of Dental Sleep Medicine, American Board of Craniofacial Dental Sleep Medicine. And so, like, these are the highest kind of distinguishing, boards that kind of govern, people like me who do what I do. And so 2018, I got triple boarded all in 1 year. It was wild.
Insane.
And so at that point, I had been treating the airway for a while, and, it started, with just treating sleep appliances with CPAP failures and things like that. And then it got it more into like, oh, we can be like the first step for these patients. We can be someone who does a comprehensive evaluation, and not everybody needs a CPAP. Not everybody needs their tonsils and adenoids out. Not everybody needs an oral appliance. Like, how do we figure out a system, an operation that we can, be the first line of defense, that we can have our general dental practices screen for this stuff, be able to refer it to me and my team, my airway team, to do a comprehensive workup, and then figure out what that patient needs. So, this has come a long way. So in 2018, I'm like, you know what? We've grown out of this umbrella, this general dental practice. I need to create my own center. I need to create a center that's dedicated to, TMD, airway, myofunctional therapy, that type of thing. So in 2019, after we built a brand new office, 5,800 square feet office, with 11 ops and no dentistry whatsoever taking place inside those doors, just limited to TMD and sleep. Here we are, like, 2 years later, we made it through COVID, and I have the most amazing team in the world. I have 2 myofunctional therapists that work with me full time. I have Dr. Joanna Green, who I know you've interviewed previously, and she's kind of, I joke with her all the time. I'm like, I've infiltrated your mind, and now you can't not see, because you know what Frank Spear says. He says you can only, treat what you can see, and you can only see what you know. So once I kind of drug her into the airway world with me, like, now she's like the queen of TOTS. She's like the frenectomy specialist. She does early intervention, growth appliances. She does comprehensive orthodontics now. Both of my kids are in active myofunctional therapy with Lauren, our myofunctional therapist. They're both in ALF appliances with Dr. Green. So we joke with the kids, they have ALF, we got ALF in their mouth. So that's what we say at our practice. But yeah, it's become a whole lifestyle for me. And I don't do dentistry anymore. I don't do any of the things that I learned in dental school, which is just wild, because I felt like, anything that I do now is like not what I learned in dental school. Like, everything was like a paradigm shift for me, and everything was a challenge to what I had previously learned. So that's sort of a long story, sort of shortened a little bit. So that's where we're at. We've created the Pain and Sleep Therapy Center in Newark, Delaware. We consider it a very comprehensive center for anybody who's struggling with, head pain, anybody who's struggling with, sleep issues, anybody who's struggling with breathing issues. Like, we really have created quite a team, and we'll get into this, not just our team, but we've created quite a network in our area. And without the network, affiliated providers that I refer to on a daily basis, like, I wouldn't even be a quarter as successful as I am today. So, I owe a lot of what I do to my team. I owe even more to my mentors that have helped me kind of grow into this and really become passionate about this and really look to change people's lives. And, it's went from, treating the adults to, now we have a heavy focus on the kids, which is just even more amazing. And, my wife has her own journey, my kids have their journey. And, I'm just here to kind of facilitate this and make sure that people get the help that they need.
That's amazing. I love it. And I know we chatted a little bit beforehand, and we have very parallel lives just in terms of our kids' age and their journeys, their health and all that fun stuff. And so, like Lily had gone through her ALF appliance, Myo, TOTS release, and Mia, we're looking at her because she's got a little bit of summertime asthma that seems to come and go. But, I'm looking at this and going, there's other things that are telling me that we may need to do some early expansion with her as well. And I love early intervention. And it's funny because you mentioned that where you started is absolutely not where you are now. You're not doing the same thing that you're doing when you graduated. And when I graduated in 2009 from grad school, I was working with preschoolers doing speech and language. And then I went into early intervention, and I was doing more feeding, and I did some feeding in the schools, but it was not allowed. And, when I went into early intervention, I got to start to do a little bit of that. But at that point I was burnt out, and I was like, I'm out of here. I'm going to work in private practice. Took about 8 months off, went to work for a private practice for a year before opening my own. And it's been a complete 180. I mean, I was specializing in working with kids with autism, and I was going, these kids have these patterns about the foods that they will eat and that they won't eat. And I was very fascinated about it. I really wanted to dive deeper into like the gut brain connection and the root cause behind some of these things that we were seeing. And that really further led me down my path to just becoming a pediatric feeding specialist. And so with that, I feel like I was already doing some of the myofunctional things. I just didn't have a name for it. It wasn't taught in grad school. I was looking at these things and going, how can we help these children? And that missing piece was truly understanding that we need to add a little bit into the mix of pediatric feeding. When we're talking about a child usually under the age of 4, it's usually more of a pediatric feeding approach I call it with a twist of myo. And once you're at the cognitive level of a 4-year-old, we'll do like a more traditional myo program. And those are obviously not hard numbers, but an SLP and trained in the space knows what they can do with what patient. And so it was very fascinating when, I took my myo course, my myo eyes were on, and I was like, oh no, I have to go back now and assess like those 8 kids. I'm not even going to charge the families. I'm just going to offer an assessment. And I'm telling you, it completely changed my treatment protocol. Everything I was doing with those children changed. I had a child who went for a emergency tonsillectomy, snoring, her AHIs, her snore was worse than middle-aged overweight men. I mean, it's incredible what is being missed in these early populations. And especially, I always preach this to early interventionists who go into preschools. If you can go pop in once in a while and listen to these kids while they're sleeping during nap time, if they're a kid who's there all day, you are going to very quickly identify children who you may not be treating immediately, but you sure as heck better be referring them out for a sleep study or to somebody who can look at their airway. Because it's, I would walk in and go, does that child always sound like that? Or are they sick right now? And, they say, oh no, she always sounds like that. And I was like, ooh, I, went to the director and I said, look, I know I might be overstepping here, but I'm really concerned about this child's health. And that led to, this happened in many instances, but there's so many different ways that we can get to helping these children and these families if we know how. And so I'm really excited every time I speak to somebody who gets it, because, the early intervention is so critical. It's critical to their brain development. It's critical to their functioning in school and classrooms. It goes beyond just like how well they sleep at night and if they wet the bed or not, which are all very important things, but it really impacts their daily function. And anyway, so I'll stop talking and turn it back over to you. But yeah, so I know you've built this amazing network. You have this multidisciplinary treatment approach, and you're getting amazing patient outcomes. How early, I guess would be the best question. How early are you all working with these patients in your practice?
Yeah, that's a great question. And let me just first start by saying, I think that's a fantastic idea, what you just mentioned. I'm going to steal that from you about like having like going into the daycares and having like the preschool teachers.
Yes, a little screening or something.
Some screening like during nap time, right? I mean, that's genius. And I've never thought of that. I feel like I need to now go around to my community and spread that information.
Yeah.
So thank you for that. I already pulled out that pearl, and that's going to, there's going to be an initiative next week for that. I can promise you that.
Awesome.
So yeah, I mean, in our practice, we like to consider ourselves, from womb to tomb is what we say. We honestly, we've grown this really awesome network of providers. And so we're working with IBCLCs who have these programs where they start getting intervention into life in the womb. Like, so they're working with mothers who are just learning that they're pregnant. They're just learning, that they're going to have a child, and they're wondering what's next. And so we have these IBCLCs in our community who, kind of walk through, what to expect and what good nutrition looks like and what good sleep looks like. I mean, all the latest research that we're seeing is telling us that, sleep disordered breathing and lack of craniofacial development and tongue ties and all these things that happen, this happens this happens before birth. I mean, this happens, and if the mother has a problem, then more than likely the baby's going to have a problem. So, we're starting early. And so we've created a infant frenectomy program where we sort of are the wide receivers of the IBCLCs. They kind of do an evaluation once the baby's born, do a feeding evaluation, and look for any structural, physical limitations, meaning ties and things like that. And then once they find them, they send it over to, Dr. Green and I to assess and figure out, if this is something that needs a revision or a release or some sort of surgical intervention, or if it's something that we just need to work with body work, or something that we just need to work, more closely with function, right? Because it's not all about appearance. It's about appearance and function and, the whole assessment here and the whole team assessment. So we get involved with babies, like, from 2 days, after birth. I mean, we have just regular LCs from the hospitals who refer to us directly right from the hospital, and then we find them a feeding and lactation home, and we go from there. We use a really team approach. So yeah, we treat the babies, and then like the gap that we had for the longest time was like we treated the babies, and then I've been treating the adults, for a really long time, and we didn't have that intermediary, piece of our practice. And so I wanted to do it, but I'm really busy with the adult part. I work all 5 days a week. I work Monday through Friday, and I'm extremely busy putting out all the fires that walk into my practice. I'm the only one in my whole entire area that does anything with craniofacial pain, anything with TMD. So I get a ton of general dental referrals. And, sort of the secret behind a lot of that is a lot of these patients that are walking in with craniofacial pain and TMD, they actually have an underlying sleep breathing disorder. And we find that, and it's something that has gone unnoticed. So then when you start, getting patients' head pain controlled, you start getting them breathing, sleeping better, the next question always is, well, what about my kids? How do we prevent them from turning into me? And I say, that's the question I asked myself when I started doing this, when I had kids as well. It's like, well, how, my wife, we can talk about this, but my wife went through an expansion. She went through a two-jaw surgery, out in California. She's going through myofunctional therapy. She's going through the whole gamut of things. I wear an orthotic at nighttime to sleep. I wear nasal cones to sleep. I tape my mouth shut every single night. It's like, well, how do we prevent our kids from turning into that? Well, we're missing this piece of our practice where the kids are, anywhere from 1 to, say 6, 7 years old when we start doing early orthodontics. And so that piece of the practice has really evolved quite significantly over the last couple of years. That's where the myofunctional piece comes into play. That's where the comprehensive exam comes into play, and we figure out, does this child need to see an ENT? Do they need to see body worker? Do they need to have nutrition counseling? Do they need to get a growth appliance? Do they need myofunctional therapy? Do they need a release? With some of their oral structures that are limited. So yeah, I mean, it's grown significantly from womb to tomb is what we say at this point. And there's no patient that we can't treat at this point. So when you say early intervention, like my 2.5-year-old got an ALF appliance, right? My daughter Reese, when she was the youngest patient in our practice, to get an ALF appliance. And it was wild because I don't know if you have any of these anecdotes from your practice, but the first night we put, and here's the thing that's really crazy. And I know you can relate to this. We always thought my son was the bad sleeper. We always thought my daughter was the good sleeper, right? My son gets up at 6 a.m. every single morning, and he's the one who kind of fights to go to bed. And we're like, man, he's not getting enough sleep. And like, once we started learning more about this and we started like walking in, watching him sleep, like he kind of sleeps like a mummy, right? He sleeps on his back. His sheets are in the same place they were when we put him to bed. He's getting that 9-10 hours of sleep, and that's what he needs. And he's fully functioning the next day. Whereas my daughter will go down at 8 o'clock and she's literally sleeping till 8 o'clock the next day. We're like waking her up, But you go in there, the hair's disheveled, the pillows are all over the place. I mean, we went in there one time. I remember she was sleeping on the floor. Like she wasn't even sleeping in her bed. She's sleeping on the floor. Like her head's down by where her feet is. Her blankets are through. I'm like, that's interrupted sleep. This is dysfunctional sleep. Like no wonder she needs 12 hours of sleep. I mean, that's not a secret. So when we started kind of going in and watching our kids sleep, and this is what we tell our parents to do when we do, our consultation, is take 3 videos, go in at 10 o'clock, take a video, go in at 12 o'clock, take a video, go in at 3 o'clock, take a 2-minute video. And then we want to see what those look like. We want to look, we're looking for lip closure. We're looking for restful sleep. We're looking for inaudible breathing. We don't want to hear the kid breathing. We're looking for peaceful sleep. We're looking for deep delta wave sleep and REM sleep that's going to, be responsible for all that cognitive development and all those neural pathways that are being formed at such a young age. I mean, that's the time where you want to get involved in these kids. So we put the ALF appliance into my daughter's mouth. I'm not joking with you. And my son got his and my daughter got theirs on the same exact day. Dr. Green put them in the same exact day. My son slept longer. My daughter slept less. It was like crazy. It was like both paradigms sort of changed, and they completely, it was just wild, because we went in there and like my daughter's sleeping in the same position and she wasn't waking up with grogginess. And so since then, I mean, my daughter's been in the ALF appliance now for, she's going to be 4 at the end of the summer. So she's been in the appliance for about a year, which is amazing. My son's been in his appliance for a year as well, and he'll be 6. So it's like, that early intervention type stuff, we don't really put an age on it. It's like, when does the kid need help? And even if we're just doing a little bit of nutrition counseling, even if we're just doing a little bit of myofunctional therapy off the bat, like some breathing retraining, things like that, like it helps, it helps a ton. Like one of my best friends was in last week for his son, who's 5, his consultation. And we literally got him off. We told him, hey, let's do a 2-week trial without dairy. And let's also, get him to use, Flonase Sensimist. And he's like, dude, you wouldn't believe it. Like, Evan is now, he didn't get up once last night. And he I went in there and he's like breathing through his nose. And like, so just like little changes like that can make such a big difference. And I mean, that, like, to your point, with your daughter, like we're when we do a comprehensive evaluation and we're taking 3D imaging and things like that, we're able to measure the cranial bones, we're able to measure the palate, and we're able to see, okay, maybe they're sleeping well, but do they still need intervention? Do they still need growth appliance? Do they still need, myofunctional therapy to get the tongue up to the roof of the mouth and get that development to happen? And so there's never too early of an age, I guess would be my answer to that. And that's a long way to say whenever the child shows signs, like they don't even have to have symptoms. Whenever the child shows a sign, and we feel like we can intervene, that's when we do it. And, for a lot of these patients, we know these treatment plans are going to take 10 years, we're going to be with them through the kid's whole entire development. And it's our goal to prevent them from ever having to come see me when they get older. We don't want them to turn into me. We don't want them to turn into my wife. We don't want them to turn into the sick people that I deal with every day. I'm dealing with sick. And Dr. Joanne is preventing sickness. So we've created quite a team, and it's just so empowering to talk about. And so I'm so proud of what we've been able to do.
Yeah. And for anybody who's maybe new to the podcast, I'm the same way. I had traditional orthodontia. I had that rapid palatal expander. I had braces. And then after that, they put me into a permanent upper and lower lingual bar. And they said, oh, this will fall out by the time you're 20. I think I was 13 when they put them in. Okay. At 30, I finally was like, can somebody please take these things out of my mouth? It is really hard to keep that area clean. And I was going for extra cleanings because of the plaque buildup beneath the bar behind my lower teeth. And so anyways, fast forward, they took it off. My teeth started shifting on the bottom, and I was like, what's going on? Come on. Like, these things have been in for 17 years. Like, this is not cool. So finally, at the age of whatever I was in my, early 30s, I went and was like, all right, something's up. And this was also after I had taken my myo course. I knew I was tongue tied, and So after I had my second daughter, I had my tongue tie revised. And from there, I was like, all right, well, I know I need an appliance. So I went through 2 years of DNA, and I'm about to finish up 1 year of Invisalign. And the Invisalign is really just cosmetic because I'm vain. So I was like,
Okay,
please,
good.
please fix those teeth that were beautifully straight before. I know my palate wasn't beautiful, but I know my teeth were at least straight.
Sure. Absolutely.
But it's amazing. It's amazing to have space for my tongue now. It's amazing to, I need a septoplasty. I'm not done. I still have other things to do along my journey to really maximize my airway. But looking at my images, and especially looking at Lily's, my 5-year-old, almost 6-year-old, it's incredible to see how much her palate grew in the course of a year. And I really think, we say this with early intervention, just in general, the sooner you get in, the faster things start to improve, right? So it's much easier to get in and work with a pliable toddler or elementary age child versus waiting till the traditional, like, hey, we got to wait till the permanent teeth come in, or an adult like myself. I mean, not as easy, and definitely it's more complex. There's more interventions needed. It takes longer. I mean, for me, even with my DNA Vivos appliance, about 50% of the way through, about a year in, I was getting body work, but I noticed that when I had to increase the frequency of I was going to work with a PT who does manual counter strain and is PRI trained, and he is just phenomenal. And I noticed that I had to go to him in order to crank my appliance because my bones, nothing wanted to move anymore. It was like, okay, you've hit a wall where, traditional person might have said, oh, we're done. And I said, my team was like, no, you're not done. We just have to make sure that we prime the environment so that you can continue to grow that palate in the way that needs to be grown. And I'm very thankful for my team. And it's really very cool to have that type of network and just that team who fully holistically comes together, looks at the individual patient cases. Okay, here's where we're at, here's where we're trying to go, and here are the different options to get there. And those options often decrease as you get older. So
Mhm.
it's
Or
nice to
become
have
like,
options with younger kids.
yeah. Yeah, I think what you're describing there is your pathway to health, right?
Yep.
So I mean, I think I've learned this, and like I use the ALF appliance in our practice. I use the Vivos DNA appliance in our practice. We use the Homeo block in our practice. We use normal sleep appliances in our practice. I use orthotics in our practice. We use a lot of different selections, variants of things that we put in people's mouths to help get to the end goal. I mean, and there's a million ways to do it. But I think what you and I have learned through doing this for so long is the body needs to be ready for it, and the body
Yep.
needs to facilitate what's about to happen. So we're kind of fools if we think we just put something in there and it's just going to change everything just with a twist or just having it in there. And that's just not how the body works. The
Yep.
body's just so much more intricate than that, and everything's connected. And that's what we've learned. It's like we've learned this from so many different people. And I think it's a great point to bring up. Like, I've learned from the best, right? I've been personally trained by Dr. Zaki. I've been personally trained by Barry Raphael. I've been personally trained by Saruzagi, by Daniel Clower, by Kevin Boyd. I mean, all these, by James Bronson, all these people that I have personal connections with, that I text on a daily basis. There's not one day that goes by that I don't text one of those guys, or I don't text some of my people that I've learned from and just say, hey, in this situation, what do you think? We collaborate. And I've learned that I'm never going to fall in one person's camp. I'm never going to put an ALF appliance in every single person's mouth.
Yep.
I'm never going to do a Vivos DNA appliance. I'm never going to refer out to Dr. Mariana Evans for rapid palatal expansion with TADS involved for every single, that's my job. My job is to do a comprehensive evaluation, pull out all the factors, find the root cause, identify what the origin of the problems are, and then listen to the patient. Like, what are the patient's chief complaints?
Yep.
If the patient just wants to get back into bed because they're snoring, I'm probably not going to push them into TAD rapid palatal expansion with Dr. Evans, which is going to take 24 months.
Yeah.
I'm probably not going to push a DNA appliance on them. I like to meet up my patients with where they're at. And that's why when I see a patient, I want to create pathways to health. And I want to say, here's one way you can do it. Here's another way. Here's this way. But I want to let you know that if you choose this way, it involves a lot of sacrifice. It involves a big commitment. It involves an open mind. It involves you challenging a lot of the things that perhaps maybe your physicians are telling you, and not to discredit any of the physicians. A lot of them have come a long way. I gave a lecture last week to the American College of Lifestyle Medicine, and have you know that they may consider adding a sixth pillar. I don't know if you know about the ACLM, the American College of Lifestyle Medicine, but it's these physicians that basically believe in lifestyle change, and they believe that lifestyle change is the best way to treat. They're not with the magic pills and just treating with pharmacology. They sort of take more of an active approach and get involved with nutrition, exercise, sleep, stress management, all that. Well, they have five pillars of health, is what they call it. And so they had me come and speak to the board, and they're now considering making breathing the sixth pillar of which would be
pillar number one.
Which would be which would be incredible. And so there's a guy named Howard Jacobson. He interviewed me last August on his podcast called Plant Yourself, and he is like, I would have said that nutrition was number one pillar of success. And he's a big ACLM guy. He's like, I truly believe and he drove from North Carolina to have an evaluation by me. And you know what my treatment plan is expansion and myofunctional therapy. And he's like, oh my gosh. So he's in this process of like changing his whole breathing and structure and function and all that stuff. But he then did a podcast on me, and he's like, I truly believe that breathing is the number one thing in the world, and is the most overlooked, undiagnosed, underrepresented, whole entire function in the entire world. And so we had hours of conversation and debate, and he wanted to learn all about it. And I think from there, that kind of spurred, the board members of ACLM to come interview me. And now I'm working, hard to try and like get people like me and you to do more presentations, because if we can collaborate with those guys, and everyone can find an ACLM trained physician in their community, like imagine how many more patients we're going to help. Like it's going to be incredible. So we need to continue to bridge these gaps. We need to continue to, go do on things that are uncomfortable for us. And like, we can't just be in our little siloed approaches. And so that's why you and I are talking this morning, right? So we can give more people the platform to say, hey, what I'm thinking is normal. And what I'm thinking I may be looked at as the black sheep in my community, but guess what? What's the saying? First they ignore you, then they fight you, then they listen, then you win, right? So, we got to go through those stages, and it's not going to be easy, but we're knocking down the barriers. We're building, networks. We're connecting bridges, and this field of medicine is just going to get bigger and better, and more people are going to get helped. And it's because of people like you. So and yourself and your book. Let's talk about your book. I mean, so sure. I think that's a phenomenal resource, right? So you've got your book, The Root Cause, Discover the Why Behind Your TMD and Sleep Issues. So I love that you've put this in writing. And I know there have been more books, I think, that have come out over the past couple of years that really help to build up this space, but I don't know if I've seen one about TMD and sleep issues per se. So tell us about it. Yeah. So COVID happened, right? Right. So COVID was 2015, I believe is the most impactful year of my life, right? That's when things completely changed. Besides that, COVID was the best thing that ever happened to me. I mean, I was kind of in this zone where I was just going a million miles an hour, like treating as many patients as I could. And COVID hit, and I ended up in my office with my kids screaming in the next room, to play with them. And it was March. And I'm like, what in the heck am I going to do with my time here? We closed the office for a month. And I'm like, you know what? I had to take inventory of my whole entire life. I took inventory of my family, of my profession, of all the people that I thought were impactful in my life. And it was a good time to just sit down and reflect. Like, you never get, you know it, you have the same age kids as me. Like, when do you and I get a chance to reflect? Mm-hmm. Right. So we don't have much reflection time. So it gave me a time to just kind of get away and reflect on, like, where do we need to go? Like, okay, I've had a lot of success, but I've had success. How do I get more people to have success? How do we create a social movement? Right. I mean, we need to create a social movement. Physicians don't change, providers don't change, educational institutions don't change without social movements. And
Yeah.
we've seen this across all other spaces. If we don't create awareness in the public's eye, then we're never going to get the changes that you and I want to see.
Yeah.
So, for me, it's like, okay, I created a new company called Integrated Airways, right? So that's my consulting company. I do like business mentorship for dentists who want to be, more like me. I do CE and stuff. So I created this 10-part CE series during COVID where I basically had, I spoke on pediatric airways. You can find all this stuff on my YouTube page and on integrativeairways.com. And I created a 10-part series where I just wanted to educate, for providers, for the public, for all that stuff. And so I realized, I'm pretty good at telling stories, and I'm pretty good at taking the patients that I've been able to treat and giving them a platform so that other people can relate to them. And that's what it's all about. Like, everybody wants to find a patient that they can relate to, because without that, I don't think you get the buy-in. You want to find someone who's like you, right?
Right.
You can look at all these people and say, well, that's that, he's overweight, or he doesn't do this, or, all these excuses in the whole entire world. Right. But you want to find someone who's relatable to you. So I said, why don't I create a book that kind of goes over my wife's case, goes over my kid's case, goes over my journey, and then pull out, 10 cases that I've been able to do over the last 5 years and just put their story in a book and let people relate to it. And I tried to pick different patients that I felt like all dealt with different things, a trigeminal neuralgia case, a case that a ton of patients come to me. The majority of my practice that I see is TMD related. And the people are coming in with head pain and they just want to get rid of their headaches, or jaw pain. And they just want to be able to open wide enough to eat a burger, right? Just like simple things like that then when we dive into it and we go into the root cause, and we ask why. And then when we know the answer to why, then we ask why. And then when we know the answer to that why, we just keep asking why until we get to the root of the problem. And like one of my other mentors, Jameson Spencer, who's like the TMD and Airway sleep apnea guy, and I've learned a lot from him. He kind of taught me, the mystery is in the history. And if you don't take a good history, then you can't figure out what's going on with that patient, and you can't figure out how to help them. And so when I was in the general dental practice, I had a really tough time going from prepping a crown, doing 5 hygiene checks, taking off my loops, and then being able to talk to someone about their sleep. I had a really, really hard time wearing that hat. And that's when I was like, you know what, I can't. I got to dedicate myself to TMD and sleep only. So, the book is about telling people stories. That's really all it's about. I mean, I would love to say that it's as powerful as like the James Nestor book. No, I mean, that guy's born to write, right? I mean, that book like literally changed my life. And I already knew about all this stuff. What an unbelievable mission that guy went on, and what an unbelievable story. And I think I have patients that walk in my office every day, like they're literally clutching that book like it's the Bible. And they're like, I came to see you because of this book. And I'm like, that's fantastic. So we need more of these, documentaries, and I'll hook you up with a couple of these guys, but a couple of my buddies in California are working on a Netflix documentary on breathing.
Awesome.
And that's kind of behind the scenes type of thing, but I'm being interviewed, Clower's being interviewed, Almost is being interviewed, Zaggy's being interviewed, the Lips Kisses are being interviewed, Kevin Boyd. I mean, all these people like in my space are all being interviewed, and we're going to have this, hopefully this documentary that's premiered on Netflix. And the goal is to create a social movement. Right. Where moms start going into their pediatricians and asking questions and demanding answers. And, people start looking for the why behind their problems, and looking for, instead of just surviving, that's another little key thing that let's not just survive, let's thrive. Right. Let's take people who are sick and create health. So these are all things that, I'm just trying to do my part to just share with the world. Hey, here's 10 cases. Can you relate to any of them? And I find that I've tried to pick, young patients, old patients, in the middle, pain patients, airway patients, all that stuff, and just try and have, more people relate to someone in the book. And when you relate to someone in the book, you then go give my book to somebody else and say, hey, you need to read this. Chapter 6 is about you. I literally read chapter 6 and I thought about you. And so, read this book and then go see this guy, and he might not be able to fix you, but he's for darn sure going to find someone who can fix you.
Yeah.
And that's what happens with me. We welcome, 60 to 75 new patients to my office per month. And like, I'd say 40 of them I'd get treated in my office. And the other 20, 30 of them, like, well, I'm sending somewhere else. I'm sending to Joanna. I'm sending to Lauren for my functional therapy. I'm sending to Mariana Evans. I'm sending to ENT. Like I'm sending out for CPAPs every day. The CPAPs can work and they are helpful for people. So yeah, the book is about telling stories, and it's special to me because I got a chance to open up about my journey and, importantly for me, my wife and my kids who mean the world to me. And COVID gave me a chance to take inventory on my family. And that's when I got my family into treatment. And, the proof is in the pudding, right? Like if you don't live this stuff, I got a septoplasty, right? I fixed my nose. And so when you talk about the root cause, like here's a quick little side story. I go in to get my teeth clean in one of our general practices. My hygienist, who's been cleaning my teeth for the last 6-7 years, she's like, "Hey, have I told you that you're grinding your teeth?" I'm like, "What the heck are you talking about?" I'm like, I don't grind my teeth. I'm the sleep guy. I'm the TMD guy. What are you talking about? I don't grind
Me?
my teeth.
No.
Yeah, I'm like, "No, I don't have any pain." She's like, "Well, your joint pops." I'm like, "Yeah, I know. It's been like that forever. It's probably the result of my orthodontist back in the day, right? Distalizing everything and pushing, my condyle back so far that I now have a displacement." Whatever. That's just orthodontics, general orthodontics in general. But, so I'm like, no possible way. She's like, "No, I'm going to show you pictures." She took pictures and I'm like, "Man, like my teeth are kind of wearing down a little bit. I'm losing a little bit of enamel here." So I go home that night. I asked my wife, this is probably like 3-4 years ago. I'm like, "Do I grind my teeth?" And she's like, "Yeah, when you sleep." And I'm like, "Why didn't you tell me this?" I'm like, "Why didn't you tell me that I grind my teeth when I'm sleeping?" She was like, "Oh, I don't know. Never bothered me. I didn't, it, didn't know if it was a problem." So I'm like, "Oh, I got to figure this out." So I do a full workup on myself, scan the whole 9 yards. I found out I have this terribly deviated nasal septum. I mean, terrible, with like a grade 4 bone spur touching the lateral wall. My sinuses were like 30, 40, 50% filled, with junk. And I'm like, "Oh my gosh, I can't breathe through my nose." So if I can't breathe through my nose at nighttime, of course, my body's going to go into fight or flight mode. Of course, my brain's going to recruit my muscles of my airway and my face to grind and clench my teeth. And once I fixed my septum, so I made myself an orthotic at that point. Once I fixed my septum, literally my grinding problems went away when I started taping my mouth, wearing my nasal cones to open up my nasal valves, got the inside of my nose fixed, and like literally my grinding went away. And now I feel like I don't wake up at nighttime. I go to bed, I need 7.5 hours of sleep. I wake up feeling great. I wake up, the Energizer Bunny, as everybody calls me, with my staff. And, it's just like, but that's all I needed. I needed my nose fixed.
Yeah.
And the nose is just so important. The nose is the pharmacist for our minds. The nose is the gatekeeper for our bodies. The nose is the weather vane for our emotions. I mean, the nose is what it's all about. Nitric oxide inside our paranasal sinuses. Like, I could go on and on about the physiology about breathing, which I won't. But like that was my problem, and everybody's got different problems. Like my myofunctional therapist, Lauren Reinhold, who's amazing. She helps people every day. Kind of like you do. All she needed was a pair of nose cones. Like that's all that was keeping her from getting into deep delta wave sleep, deep restorative sleep. Like she was waking up every hour because of this collapse with her nose. I did a workup on her. I said, "Lauren, you're like healthy. You're like healthy as a horse. The only problem is your nasal valves are pinched shut. You have no room to get air into your nose." And she's like, "Really?" So I gave her nose cone. She's like, "Oh my gosh." She's like, "Ryan, I slept through the night last night." I'm like, "Get out of here." So since then, I've had 3 more hygienists in our general practice that have come in that have just needed nasal cones. Like no expensive treatment, no surgeries, no expansion. Like literally their chief complaints was like waking up at nighttime. And with nasal cones, now they're breathing better, and they're staying into deep sleep. So it can be simple. You got to meet people where they're at, and you got to take inventory of what their chief complaints are. And you have to work tirelessly to fix the chief complaints, because once you fix somebody, they're going to go tell their friends, they're going to go tell their family, and they're going to just, shout you to the mountaintops to, anybody who will listen. And we've just created such believers in what we do. And so my book is about putting those patients on a platform.
I love that. And it's, on my website, it actually says something like, because we talk about the transformation that we give our families, and it says something like, from surviving to thriving, we help our patients and their families realize what is possible. And it's one of those things. I also do coaching with private practice owners in our space. And I have a mastermind of individuals who wanted to grow their practices this year. And so they're in the business mastermind that I run. And we talked a lot about, it's not so much about the marketing is not about, hey, here's what I do. It's about what transformation are you going to give to these individuals that are coming to see you. And I think that thriving it's subjective. That's defined by your patient. What does thriving mean to them? And so I love how you've highlighted several times one thing that I preach. We may feel like we know the best plan. We know what we would love for you to do, but we also know it is a financial commitment. It is a time commitment. It is an energy commitment. It is like, this is going to be your life for a number of years ahead of you. And so if you're not fully bought into that and that's not your goal for yourself, we need to meet them where they're at. And I've had adults come to me and small jaw, very crooked teeth, or, they were developing an open bite that was continuing to open up. And this individual was in their 30s. And they said to me, I don't want the appliance. I don't want surgery. I don't want years and years of therapy or appliance work. I just want to stop this from continuing to get worse. And I was like, okay. So we did myofunctional therapy, and I'm telling you, in 6 sessions, she was well on her way. Her tongue it didn't fit that well in her palate, but it fit as well as it was going to with the anatomy she had in place in which she wanted to work with. And we did teach her to stop thrusting her tongue forward and swallow properly to the best of her ability, which means she's no longer going to have that tongue resting on the teeth or pushing against the teeth while she's swallowing. And, for her, that was her goal. And that's where I had to meet her. And, as much as I know it sometimes kills professionals in this space, because we go like, oh, I know what we could do here. Like, this would be such a cool case to see it all the way through. Seeing it through for them, they get to choose what that is, right? They get to define that. And I want to be able, just like you, to meet that person where they're at, give them what they're requesting. And hey, sometimes they turn around and go, you know what? Like, I know that I said I only wanted this, but I now realize what I was missing out on. I didn't realize that my sleep was so awful. I didn't realize that it wasn't normal to feel this exhausted and have this excessive daytime sleepiness. I didn't realize that, I had all these other symptoms that were connected to what's going on in my mouth. And when they start to taste a little bit of how much more, how much better they can function during the day, they go, okay, I want more. Now I've become a little bit of a junkie. And I've had some patients who then go, okay, what's next? I'm committed now. Like and that's because we just started little, we got their foot in the door. We gave them what they asked for. We didn't push our agenda on them. And then they, and not everybody, some people are just happy to have that, whatever that quick fix is, even if it's not addressing the root cause totally. But for all intents and purposes, I love that you really speak to individualized therapy, listening to your patients, figuring out, what's going on, where this all started, and what we can do for them today based on their goals for themselves. So I think that's really an important point, because we can definitely still make a lot of improvement and changes for a patient, even if they're not going the full gamut. So let's talk about, I know you have an airway symposium coming up, a pediatric airway symposium coming up this fall. So share that with us so everybody knows about the event.
Yeah, I'm super, super, super stoked to kind of get this message out. I mean, this is it's full circle, right? I started treating the adults who were sick. Then they asked me how they could treat their kids. And now we've dedicated a lot of our practice to treating kids. So I felt extremely honored. This is the 4th annual Pediatric Airway Symposium. And I'm going to give you a couple side stories because I always do. And I'm going to take us down a rabbit hole. But the 4th annual Pediatric Airway Symposium is for all professionals. It's for SLPs out there. It's for PTs. It's for OTs. It's for physicians. It's for pediatricians. It's for orthodontists. It's for dentists. It's for everybody to come and it's for ENTs. It's for pulmonologists. It's for everybody to come and learn about how we can impact today's youth. How when do we intervene? What things do we need to look for? If everybody just knew a list of 5 things to look for, good gosh, we'd be able to treat thousands, maybe millions of more patients. So, Daniel Clower, who's one of my best friends in the whole entire world, he put this on in his hometown of South Bend, Indiana, 5 years ago. We missed last year. Well, I was supposed to have it last year. Of course, COVID happened, right? And so we had to push back a year. So it went from, I believe, South Bend, Indiana, to, then it went to maybe Missouri or Kansas City or somewhere in the Midwest. Then it went out to San Jose, California, and now it's in Philadelphia. And I was asked to host this. And this isn't my event. I'm being asked to host this. So it's really special to me. I think we've got an incredible speaker lineup. Dr. Zaghi is the keynote speaker this year. Dr. Stephen Olmos, for people who don't know that, he's been doing this stuff for like 40 years. He's the king when it comes to clinical protocols and systems and things like that. He's who taught me how to create a comprehensive system in my office. I use all of his protocols for new patients in my office. He's speaking, like I said, Kevin Boyd, Daniel Clower, Eric Phelps, Mariana Evans, Crystal Fincham, who's my functional therapist, myself, Darius Lagmani, who's a sleep physician out in Chicago. There's going to be there's going to be a panel at the end. It's going to be a great, like can't miss event. We're doing in person and we're doing virtual. We realize, we decided to do virtual just so we can get more people to hear the message. The goal is to have everybody come. The goal is to have 500 people to come. The goal is to have everybody come and be able to network and be able to shake hands and be able to create, this synergy. But if they can't come, they can at least sign up for virtual. We have this Remo platform that we're using this year, first time ever, special little story. And this is kind of close to my heart. 2 years ago is when my wife had her aha moment. We went to San Jose, California, and I roped my wife into going with me. Now she's been working for the business sort of a little bit, with like branding and like marketing and that type of thing, but she never really had her why. And of course, I'm sure you can relate to this with like your husband. You tell your husband something, he's like, yeah. And then like somebody comes who's maybe doesn't even know as much as you and tells your husband something, and your husband's like, did you hear what she said at dinner? And you're like, that's what I say every single day to you. Like, what are you talking about? And so like, she just needed to hear it from somebody else. Cause she's like she thinks I'm crazy, like with all the passion that I have with all this stuff, but now she does it. So she went out to this pediatric airway symposium. I roped her into it cause I promised her we would go to Napa for wine. So it was in San Jose, California. We went to the pediatric airway symposium. They were going to head right up to wine country and do this great event. It was myself, Dr. Green, Dr. Green's husband, who's a dentist, Dr. Kyle, and my wife, Renee. And so she meets up with Dr. Clower in the hallway, and Clower goes, yeah, are you coming in? And she's like, nah, I think I'm gonna just sit in the hallway, do some work and have some coffee and things like that. At the end of the day, we're going to go up to Napa. And Clower goes, oh, I reserved a seat for you in the front row. And just kind of joking with her. And she's like, really? Do you think I should come in? I'm like, yeah, I think you should. I think you'd learn. So she comes and listens to this full day. And like, at lunchtime, she goes, oh my God. She goes, remember that girl that they showed? She's like, that's me. And I was like, I know. And she's like, that's me. Like, that's my whole entire childhood. And I was like, I know. And she goes, oh my God, like, what do I do? And I'm like, I think the first step is you come in for a comprehensive exam and we kind of figure it out. So we get back, she comes in for an exam, my wife, beautiful, big set of teeth, just, big, beautiful, broad smile, even a little bit kind of gummier smile, really kind of more long in the face and narrow. I mean, beautiful, beautiful girl. We did this comprehensive evaluation, and I didn't realize all the stuff that she struggled with when she was a kid. Like, I didn't really realize it all, but she had like chronic ear infections. We traced back her record. She had 9 sets of ear tubes, 9.
Wow.
And in the myofunctional therapy world, like ear tubes, ear issues, equilibrium issues, swallowing issues, this is all dysfunction. Yeah. This is all muscular dysfunction. And so then I had her mom start tracking down all these old photos for me. Every single picture that we looked at, thumbs in the mouth until she was 7. Every single picture that we looked at, and you'll see this if you come hear me speak at Pediatric Airway Symposium. Every single picture that we looked at, when she's sleeping, she's got a blankie in her fingers. She's got her thumb in her mouth, and obviously her tongue is resting low. So she grew like this. So she's got this really, really steep mandibular angle. Somehow all 32 teeth erupted into her mouth in this little tiny palate. She's got no room for her tongue. She's had all these like hormonal issues, GI issues. She has like, I personally filled 23 cavities from 2012 to 2015. She had 23 cavities in between her teeth that I had to fill. Now we realize that was because of mouth breathing. Like, So my wife had this aha moment. We did this whole comprehensive workup, had her take a sleep study. Of course, she didn't come back with sleep apnea because she's breathing a lot. She's like a hyperventilator. She's breathing like, I think it was like 17, 18 times a minute, which is just ridiculous. As you know, you should be at like 10 to 12 breaths per minute. But she's like audibly breathing through her mouth all night long. And it's very frustrating for me to look over and watch her like have her lips open like this, breathing through her mouth. I can hear her breathing throughout the entire night. She wakes up, she's ready for a nap 2 hours later. It like probably was a wedge that was created inside our personal relationship where I'm like, geez, like you're so lazy. Like, why are you so lazy all the time? Like you always need a nap. You want to go to bed at 9 o'clock. You don't want to wake up until 8 o'clock in the morning. Like, it was probably a big divide with us.
Yeah.
And so all the light bulbs went off for her and like, we got her help. So she came in, she did comprehensive evaluation. First place I sent her was myofunctional therapy to correct all of her dysfunction. Lauren started working with her, and then she started wearing like an orthotic. And then we're like, you know what? She's like, I want more. I want more of this. I want to learn. I want to have the structures in place that I can use because I now know how structurally, insufficient I was. So we sent her to Dr. Evans. Dr. Evans did TAT expansion. I mean, she got the big Michael Strahan gap, during COVID, got this big, beautiful palate, got everything back together with orthodontics, but her lips were still wide open. She still had terrible, terrible lip incontinence just because of that really steep, mandibular angle. So, we kind of went back and forth with this. And then eventually she went and saw Dr. Gunson out in Santa Barbara. And he did a 2-jaw surgery where, he basically corrected all of her skeletal, problems. And now, I mean, you'll see the pictures when I present it. It's beautiful. Like she can touch her lips together. I look over at her every night and I just like love her even more, which is terrible to say, but like, I love like looking at her and like seeing that her lips are touching. She sleeps like 7 hours nowadays and she gets up with me. She goes to bed at 10:30, 11 o'clock at nighttime. She gets up at 5:30 to work out every single morning. She doesn't take naps anymore. I mean, a complete change. Like she can get on an airplane and not have to like have this intense pain that she dealt with all of her ear issues. Her hormonal issues have calmed down. Like, that patient would have gone unnoticed.
Yeah.
Like she doesn't have high blood pressure. She doesn't have sleep apnea. She's one of these upregulated sympathetic nervous system patients who has upper airway resistance, who never, ever, 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 ever would have been identified in our normal medical model and in our normal dental setting.
Yeah, that was me too.
You,
all
right?
of my labs came back, beautiful. Oh my gosh, they've even increased, the vitamin D required and you're in the top 10%. Do you get more? I'm like, I barely go in the sun. I don't know how that's happening. I mean, they would tell me all these things about my labs and everything that look beautiful. Everything's, perfect. And I'm going, okay, but I'm exhausted. I fatigue very quickly. I get headaches. They're not migraines. My sinuses are awful. I mean, there was one point in my 20s where I was getting sinus infections every spring and fall, and they would put me on 2 rounds of Z-Pak followed by Augmentin. And finally at the 4th time that happened, I said, can you please look at my chart? Like, this is the 4th time that this has happened. And they ended up putting me on Augmentin right away that time, and it cleared up much quicker. I'm like, I have been on medications almost probably 70% of the months this past year. I'm like, this is not okay, because when you put somebody on this many rounds of medication, like, 1, my body's become resistant to Z-Pak, that I just don't respond to it anymore. I'm like, and 2, we shouldn't need traditional medicine to fix this. Somebody should be looking into why this keeps happening. And I finally was like, you know what, I'm taking this into my own hands. And that was in my 20s before I even knew better. That was before I ever entered into this space. But I knew something was off. And I spoke to somebody yesterday who has a podcast, Sleep Apnea Stories. And she said, she was the same way. She was like, I had excessive daytime sleepiness. Everybody was pushing me off, telling me I was fine. Oh, it's this. Oh, it's that. Oh, now you're a new mom. That's normal. And she said, the wake up call is when her 6-month-old was in the back of the car and she fell asleep at the wheel. And she said, thankfully I woke up right before I hit a truck and I didn't hit it. I was able to, hit my brakes. She's like, but I went to Google and figured out I need a sleep study, and I demanded it. And how many patients have to fall through the cracks and have these awful experiences and not understand even what they're missing out on a daily basis from a functional standpoint, because doctors don't know what to ask for or look at. And they just write it off to, oh, well, everything's coming back normal on your lab, so I don't know what to tell you. And I'm like, these are the patients. I've had grown men cry in my office in tears because they're like, I've seen 13 other specialists and not one person asked me these questions or told or believed me. They did not believe that my dysfunction or that what I'm feeling. They just told me I had PTSD or that I needed to go on, medication for depression. Or I can't imagine why you're depressed and you're having issues. You're not sleeping. Your body's constantly in fight or flight. And so there's so many patients, even with very overt symptoms, I think for us at least, that are absolutely falling through the cracks on a daily basis. And, I love that you're working with early intervention and trying to prevent people ever getting to that position as an adult. But for those of you who are adults who are in that position, there are things that can be done. And, I don't talk about it much, but my husband is in a growth appliance as well. And, I haven't gotten permission he doesn't like his stuff being as open and public as the kids and mine are, but he's in a growth appliance and he's got a tongue tie and he needs myo. And so it's baby steps with him, with my own husband.
Sure.
And, it took him going to our airway centric dentist and having that team say like, holy cow, like getting him to switch over from his dentist that he went to this dentist who I grew up with, mind you, and he's like, well, she's just going to tell me what you tell her to tell me. So I don't know. Do I believe her? I'm like, yes, you believe her. She'll take scans. She'll show you imaging. But it's been incredible because he's had growth and for him, it was starting with an ALF appliance, even though we know that that's not necessarily the best appliance that we think for him. He's had implants and we know that he'll hit a wall at some point, and probably need a second appliance. But that was that baby step that we had to take because he was like, I'm not going into that DNA Vivo. So I watched you sleep in that thing for 2 years. There's no way you're putting that in my mouth. So, that was our baby step in with him. So we'll see where that goes.
I mean, but it's a great point. It's just like meet the patient where they're at. And, when we put on these events and you do these podcasts and, people come to these pediatric airway symposiums, it just takes one person, like, saying something that resonates with the patient. And now they're on their journey and not everybody wants to go on the journey, but at least they know that it's there for them. And, we're not going anywhere. You and I, like we're just creating more people underneath of us who can do what we do. Cause we know we're not artists, we're scientists really. We want to make sure that, the things that we know in our brains, we're able to kind of teach other people how to do what we do and help more people. So I think one of the things that you described that I think is really powerful is hope, right? A lot of patients, like grown men coming into your office and crying. You know why they're crying? Because they have hope for the first time. They've we joke about it all the time. I'm oftentimes the 6th or 7th, 8th specialist that someone has seen. No one's given them any answers. There's probably not a week that goes by. I know there's not a month that goes by where we don't get at least one person like literally sobbing at their consult. And it's because we've just shown them what has gone on. They've had that light bulb click in their head and they're like, oh my gosh, it makes sense. I haven't even touched them yet. I haven't treated them yet.
Right.
But what they're crying about is called hope. And hope is something that you can never discredit, because when a patient has hope and a patient begins to know that their symptoms there's a root cause behind it and there's a way that we can fix it, it's overwhelming for a lot of patients. And some people, like your husband, we start small and they eventually ask us for more. And some people we go full boat because they're ready to take their journey the moment they walk in. And so it's cool. But that hope thing, like, don't ever discredit that. Like when you give someone hope, you've just given them a new lease on life. And that's extremely powerful.
It is. And it's what I love about what we do. So, well, I will, I don't want to take up too much more of your time today. This has been amazing, but we will definitely link the Pediatric Airway Symposium. And I will say, Mariana Evans has been on the podcast. I've heard Darius and Kevin both speak in person at Jane Bronson's event live a couple of years back in Virginia before COVID happened. And so I know these are some phenomenal speakers that you guys have lined up. I know Sarush Sagi, I've heard him speak virtually several times. So, it looks like it's going to be a phenomenal event in Philadelphia, October 23rd or 22nd to 23rd. So again, we'll link that in the show notes for anybody who's interested. And just thank you so much, Ryan, for joining me today.
Yeah, this was awesome. Thanks so much. I hope to chat with you again in a couple of years when we're doing even newer, cooler stuff, because you and I both know this is an evolving field that we're in. So we joke it's the current version of what we're doing now. So thanks for all your contributions again. Really appreciate it. And look forward to speaking with you again.
You as well. Thanks for listening to this podcast. If you want to hear more of these myo, tots, airway, and feeding related episodes, be sure to leave a review on Apple Podcasts or pledge a small amount on patreon.com/the Untethered Podcast. If you found value, others you know in this space will too. So be sure to share this episode on your social media platforms and join us over on Facebook, on my Facebook page at Hallie Bulkin Biz, on Instagram at Hallie Bulkin, and you can head over to theuntetheredpodcast.com to grab a copy of the show notes, where you can also subscribe to be kept up to date on the latest podcast episodes.